Hi, I would like to introduce to you Hildegard Peplau. This is Nursing History, April 30th, 2014. This is Dr. Shelley Randall's class. Hildegard Peplau was born in 1909 in Reading, Pennsylvania. She has become known as the mother of psychology and also the nurse of the century. Her works helped to develop the first specialty of psychiatry in the field of nursing. Her works greatly impacted the field of nursing, and in 1998, she was inducted into the American Nurse Association's Hall of Fame. Peplau was born in Reading, Pennsylvania in 1909. She graduated from the Pennsylvania School of Nursing in 1931. And in 1943, she received a bachelor's in interpersonal psychology. From 1943 to 1945, because of World War II, she served in the Army Nurses Corps there. In 1952, her book was published, and her book was called Interpersonal Relations in Nursing. In 1995, she was named as one of the 50 Great Americans by Who's Who. In 1997, she received the Christine Riemann Prize. And in 1998, she was inducted into the American Nurse Association Hall of Fame. And in 1999, she died at the age of 89 years old. Her significance to nursing is her main contribution was her theory of interpersonal relations. And in this theory, it consisted of 4 different phases. There was orientation, identification, exploitation, and resolution. The significance to nursing that Peplau specifically had was definitely the publication of her Interpersonal Relations in Nursing in 1952. Her research and clinical work contributed to the development and acknowledgement of psychiatry in nursing. She created the first master's program in clinical psychology at Rutgers University College of Nursing, located in New Jersey. In the summertime, she did multiple workshops with nurses to train them in clinical psychology. And she is also known for creating the phrase psychodynamic nursing, which regards the relationship between the nurse and the patient. The images of nursing in the 1930s were very different from today's time. The mass media recognized nursing as a true profession, which required education and the development of skills and knowledge for its practice. And nurses were depicted as brave, rational, dedication, decisive, humanistic, and autonomous. Some of the motion pictures that played a huge role in shaping this positive nursing image of women to the public by developing certain movies. And here are a few examples that they consisted of: The Trained Nurse, The White Parade, Vigil in the Light. World War II also helped shape the image of nursing. I'm sure you can remember the recruitment posters by the military. It showed nurses as being serious. You can do it. Kind of grab the bull by its horns, gung-ho. And they were very professional and admired. And Peplau also served in the Army Nurse Corps from 1943 to 1945. Her education, again, consisted of graduating from the Pennsylvania Nursing School in 1931. In 1943, she received a bachelor's in interpersonal psychology. And, of course, in 1947, she received her master's in psychology from the Columbia University. And just in general, during this time in the 1930s, the women's education began to grow and become more popular among women in trying to help provide for their families and also to help become better citizens in the community and helping the community out, especially during the war times. Our socio-political climate during this time, during Peplau's life, in around the 1930s, Franklin Roosevelt was president. And of course, 1929, we had the stock market crash, and the 1930s began within the Great Depression. And because of this, tons of Americans were unemployed. They didn't have much money. They kind of had to just make do with what they had. They loved movies, musicals, radio, sports. Those were all ways in which they could stay happy during this sad time and just to kind of forget their worries. Roosevelt, during this time, created something called the New Deal. And the motive behind this was to help improve the employment rate. And it did somewhat improve the employment rate, but not as much as they had anticipated. Advances in nursing during this time, the big deal was the antibiotics. Fleming had discovered an antibiotic, and this, I believe it was penicillin, and this antibiotic, they were administered to lots of the sick soldiers, and they lived because of it. And so this was the beginning of antibiotics and its administration, and it began to grow, and which in turn saved millions of lives. And also during this time in the 1930s, nursing began to improve care by improving their guidelines and standards of care, specifically in their cleanliness, which doing this would prevent the infection rate, which would decrease also complications and death. During this time, workforce issues, due to the Great Depression, you definitely had lots of unemployment. And hospitals, actually, you had community nurses, private nurses, and hospital nurses, and hospitals actually offered nurses room and board and laundry services instead of the wages during this time, and that was very appealing. And a lot of the community nursing nurses, they went and left their jobs for the hospital job because of these. Because of their offer. During this time, of course, the major events was the starting out in the 1930s with the Great Depression. America also just experienced a lot of natural disasters during this time. It is said that they had the worst drought in American history, and also they had a lot of dust storms which would take away the soil that was used to help plant crops during that time. And of course, at the end of the 1930s, World War II was brewing, and America was soon enter into that war. Peplau, just on a side note, was one of 6 kids. At a young age, she witnessed the deadly flu epidemic of 1918, and she saw the effects that it had on the families also. And interesting, her book, Interpersonal Relations in Nursing, she actually published it. She wrote it 4 years before it was published because of the controversy they had of just a nurse writing a book without any input of a physician. And in 1996, the Academy of Nursing recognized Peplau as a living legend. and it has been argued that Dr. Peplau's life and work produced the greatest changes in nursing practice since Florence Nightingale. Thank you for listening to my PowerPoint.